Welcome to Aesthetics Unfiltered, honest conversations about regenerative, doctor-led aesthetics. This series is designed to share relevant, evidence-based information so you can make informed decisions about your skin and treatment options. So today, Kerry, we're talking about the rise of regenerative treatments.
Yes, and it's very exciting.
Yep. And ageing well.
Yes, I love this. I love talking about this. But what I'm going to do is ask you, why is collagen such an important part of healthy, resilient skin?
This is a huge topic.
It is.
Collagen is a buzzword, as we know. Collagen is the most important protein in our skin structure. It changes a lot across the lifespan, but essentially collagen is what gives our skin its strength and its structure. It's really important to maintain the extracellular matrix. It's the ECM. This is the meshwork of collagen and elastin fibres and all of the little cells that work together to create healthy skin. So they're all part of your skin.
I love this because when Libby talks on stage and is educating people about how the Ulthera works,
oh yeah,
it is fantastic.
I do a lot of this
because and your slides, and that really depicts really well what happens and why it is so important to do that, and even in your 30s.
Yes, so
very, very important.
You want to be doing all that you can to boost your collagen and keep as much healthy and functional collagen in your skin as possible, particularly as we get older. So on that, now there are a lot of regenerative treatments, and I say that, in little asterisks.
Yes.
Regenerative treatments that will boost and stimulate your collagen and your elastin production. Now, regenerative aesthetics seems to be a term that has become quite popular, but
it's the buzzword.
It is a buzzword as well.
Really. Yes.
Some treatments that are marketed as regenerative aren't necessarily regenerative. So when we talk about regenerative, we're talking about doing what we can to create more collagen and elastin, essentially, or to create new skin cells or better healthy skin, or boost the skin. So treatments like the Ultherapy Prime machine, so the micro-focused ultrasound with visualization, that's really good to start in your late 30s, early 40s.
It's a foundation treatment, really,
yeah, it
isn't
is.
it?
Yeah, a foundation treatment. These regenerative treatments are foundational. Most patients are looking at starting these treatments in their late 30s, early 40s. I don't like the term collagen banking. It's also a buzzword. It refers to trying to boost as much collagen as you can before you hit menopause, because we know that our natural collagen production essentially falls off a cliff. We lose a lot.
But we also know that if you try to do too much, too quick,
exactly.
It's not right.
You can do all sorts of treatments to boost your collagen and elastin. It's not necessarily banking, so I don't really like that term. There are other treatments that can boost your collagen and elastin. We're not necessarily allowed to talk about them in depth because they do involve the use of a medication, and in Australia we're not allowed to talk about them. But these sorts of treatments we're seeing requested more and more, and by patients who are younger and younger. Not necessarily a bad thing. I probably wouldn't start these sort of collagen stimulating treatments that happen deep under the skin and deeper tissues in your 20s or in your early 30s unless you've got significant skin laxity. But we should start thinking about them.
And I think that's an important thing, because there'd be a lot of clinics that would offer this type of thing that probably might take advantage or give misinformation.
That's true.
On this sort of thing. So it's really, really important that you do seek out very clear medical, I think doctor-led treatments for that type of thing. Yes. I think that's one big thing is I'd see is starting early, but not too early, and it staves off having to have other things.
Yeah.
It keeps you looking really fit, well, healthy for your age.
Yeah.
It's keeping your own collagen and elastin.
Yeah, that's right.
Without there being any sort of other...
And without altering your appearance significantly, like dermal fillers can as well.
And we are going away from that now. There's been a very big shift away from that look.
Yeah, from pumping up your tissues.
It is absolutely fantastic to hear because, yes, it doesn't look great when there's big lips, big cheeks, and it looks very unnatural,
it does,
especially these days.
Yeah, definitely.
Very, very different.
How do regenerative treatments fit into long-term anti-aging strategies?
It fits. It's so important that if you are going down this path, that you look at what your options are, you pick a clinic that really knows what they're talking about and that has really got the runs on the board with, they've got the knowledge, they've got the devices.
Yeah, and they're not just using products that have been pushed by the, by marketing. They've actually looked at the evidence and the science behind the products that they're using.
And do the clinics have the devices and the knowledge?
Because there are lots of things marketed as collagen boosting.
Marketing is a wonderful thing. You can sell us to the Eskimos with really great marketing. But it's one of those things, I think you should, if you know somebody that works at a clinic, have a look at what they look like. If their skin looks really great and you think, wow, that is, looks terrific, then that might
look natural and normal and well for their age.
That
age
is where you should be going, is because when you walk into a clinic, the staff should look like what you think looks normal.
Yeah, absolutely.
And if they don't, you need to turn around and go because you will end up
morphing into one of them.
That is their aesthetic idea and that will be the road that you will go down. So what questions should patients ask before committing to a treatment plan?
To a regenerative treatment plan, very good question. I guess if you're going to undertake any treatments that are designed to boost your collagen. I know I'm using a lot of buzzwords and it does simplify things. It really is a complicated topic. But if you're wondering if it's going to work for you, make sure that you're asking the right person to start with. Make sure that you don't have any underlying medical conditions that are going to stop that treatment from working. So if you've got a raging out of control autoimmune condition or you're on high dose steroids, uncontrolled diabetes, if you have one of these conditions or you're a heavy smoker, I don't think you're going to get the result that you're hoping for out of a collagen boosting treatment.
Well, I mean, and this is once again coming back to, you need to go to a clinic that actually takes your medical history and actually knows what the condition is and how then that, because
affects the treatment.
You would change your treatment plan significantly between patients because one might have rheumatoid arthritis and be on huge,
doses of steroids and all sorts of things.
Exactly. As opposed to somebody that comes in that's fit, well, healthy, has no medication, no problems.
Smoke a pack a week, pack a day.
So, they're probably going to come in looking quite good anyway if they lead that lifestyle. So you'll be able to, then they will have a treatment plan that way. Ones that have a complicated medical history doesn't mean that they can't be treated.
No, that's right. And
that's important for them to know. There is help that you can do.
Their skin health, absolutely. Kerry, as someone who's been in the industry for a little bit longer than I have you found that there's been a change in the conversation about people used to ask, how do I look younger? But now they're asking, how do I look better for my age or how do I age better? Have you seen that?
Well, yes, we haven't had anybody come into the clinic and ask, how do I look younger for a long, long time.
Good point.
I think it's now changing, I think, what's out there. And there's enough, I think, with social media now that people are understanding that it's not about looking younger because let's face it, the face, the neck and the hands for women of my age and décolletage really can be quite jarring if you're trying to look significantly different in this. You've got to just really look and think, I think you need to be fit and well for your age.
Exactly.
You know,
age appropriate.
it comes down to your diet. It comes down to your lifestyle,
exercise, sun exposure, all these things.
And sun is the biggest thing. I don't know how many people that find out that, you know, we've got a clinic and will say, oh, what can I do for my skin? And you look at them and they've been in the sun for 30 years without sunscreen and not much apart from
the damage is done.
Ablative laser. I mean, like burning them off. The whole and even that comes with its
downtime,
risk complications. So the good news is that we don't see that anymore.
People asking to look younger. No, I haven't seen that. I think it's great the conversation has changed.
And I think if they're looking for that, I don't think we're seeing them because we are well known for being very conservative in what we do. So, yes, we don't hear that.
I think with the rise of the wellness industry, people are a lot more aware of their health and things that they can be doing to optimise their health and their skin health.
And there's so many studies now that do show that link between smoking, sun, and sugar is a huge thing.
Yeah, like so eating refined foods.
I think for that, I think we've really got the good information happening now that, look after yourself if you want to age well.
Yeah. I think there's obviously fantastic evidence and science to support a healthy diet, regular exercise, sun protection in improving your skin health. In the wellness industry, it's this whole dark side of extra things that people are
I'll be aware of people selling collagen supplements.
Yeah, collagen supplements. Yep, very minimal, if any, evidence that it works. Don't waste your money. Biohacking, peptides.
Peptides, that's another whole big thing, wasn't it, at the conference. So they will be other things that we can get into at another stage. But, don't inject peptides.
Look, I think it's great that the conversation has changed from people asking, how do I look younger, into how do I age better? But we do need to be really careful and aware of the fact that there's a lot of misinformation out there. Hacking into this thought that I can age, really slowly, or I can
it's going to take you a lot of money, from what I can gather, with people trialling it all. But I don't think there's any quick answer.
No.
So in wrapping up, good diet, exercise, well, when you can. And one of the big things too, when you're doing regenerative, you've got to have good skincare. If you haven't got good skincare and you're not feeding the skin and keeping it healthy.
And you're trying to do regenerative treatments that are designed to boost collagen.
So wrapping it up, they are the quick things that you have to do if you are looking and serious and starting to spend money. You don't have to do it. On regenerative treatments, you don't have to do it, but that will be how you'll get your optimal results.
Absolutely.
Yeah.
Good.
Excellent.
Every face is different, and that's why personalised, evidence-based Every face is different, and that's why personalised, evidence-based planning matters. If you have specific concerns or want tailored advice, consider booking with your local doctor-led aesthetic clinic as the first step before committing to any treatment.